A little bit.
Oh, that was a shocker.
Yeah.
But I did it.
No, I did. Stop taking credit for my shit.
We have 67-year-old Mary Lou. Love this girl, retired school teacher of 35 years. Loves frickin' tennis 7 days a week. She has radical plantar fasciitis. That's foot pain for you guys who don't know. She had a 3-level surgery for her neck because she had bad carpal tunnel last year. You get to see that on the x-rays right now. She had knee surgery. She's been to chiropractors, podiatrists, had multiple injections, no help. We're going to help her here on camera. Woo!
Keep your shoulders down, please.
Ooh,
Right
that
under
was
her
fucking
surgery.
gnarly. Hi, my name is Mary Lou. I'm 67. I'm a retired school teacher and I'm passionate about tennis. I have plantar fasciitis so badly now that I can't play tennis. November it started again and I played through till 2 weeks ago and then it got...
My favorite part is that what were you doing since November so you can keep playing tennis? You said you wouldn't stop, you wouldn't walk with your friends.
So I see girlfriends for lunch, and I said to everyone, I can only meet you at a restaurant. I cannot walk anywhere. I wouldn't walk with anyone. I just said...
No mall,
nothing.
No hikes.
No.
Walking down the street for coffee.
No, I was like, I'll talk with you, but I have to save myself for tennis.
And how many days a week do you play?
I was playing 7 days a week.
Yeah. You have a chiropractor you've been seeing for how long?
Month. I saw one for 2 months, one for 1 month.
Before seeing me.
Yeah.
Right, gotcha.
And I saw the podiatrist. I've had 2 cortisone shots. Nothing has helped.
Plantar fasciitis 11 years ago. What did you do back then?
I saw a podiatrist and I got 3 cortisone shots and it went away.
It went away back then, right?
Yeah.
This time it hasn't gone away. So
Zero.
So she got a referral from JP. Thanks, JP.
So I had a partial knee replacement in 2020. I started playing tennis and I immediately got problems of my hamstring. So then I went to, I got physical therapy, got better. Then I got tennis elbow. I went to a chiropractor, got better.
Carpal tunnel in her right hand about, a year ago? And
Yes.
she went to the neck surgeon. Why?
My arm would go numb and it would ache. I couldn't walk because
gotcha.
I couldn't take a walk.
You couldn't walk?
No, because the down motion
Oh,
was
interesting. I didn't know that. So
killed.
what did they convince you to do?
I had neck surgery.
This is the big deal.
C-
and she's leaving this out. This is a
C5, 6, and 7.
And it is freaking woo!
I
Big
had it
spaces in
shaved
there,
and a
shaved.
spacer.
She has a thing in there.
Yeah.
And the worst part about it is they left C4, C5 open, but it's totally worn out too. Completely worn out. I have no idea why they didn't fix that one at the same time. But her neck is messed up. So this is a post-surgical treatment, guys. This is not just plantar fasciitis. She had the surgery a year ago, right? No, 6/23. So not even a year.
Not even a year.
So you're going to ask, how do you adjust the neck at surgery? Aren't you scared, Dr. Thayer? Hell no, I'm not scared. You know why I'm not scared?
I'm scared.
Not going to hurt me at all.
I know, I get that.
So I'm not scared because I know that I'm going to help her more than anybody else could. She should never have had the surgery. Never have a surgery without talking to me first. If you get railroaded into surgery, come to me first.
I didn't know about you.
Because the problem is that she's never going to recover as well as she could have if she didn't have the surgery.
I get it.
Gotcha.
But we can't fix that.
No, we can't, but I want to tell them. It's not about you. It's not about you, Mary Lou. It's about everybody else. It's about you people out there. We love you. We're going to learn from her fuck up.
I hope I help all of you.
Not yet. Yeah. And what do you feel right there?
My
Right leg?
right hamstring. Tension, I would say, is like a 3 or a 4.
It's fine.
Just your neck? Any problem there?
No.
Look at the ceiling. Any tension there?
No.
Stand up on your toes twice. I don't have you.
Okay, this is nothing. This feels great. Except
feels
I don't
great.
have any balance.
Good,
Whoa,
good.
I'm
You
good.
see, no balance. No balance.
Whoa.
Okay.
Okay, I did it.
Yeah, good. Now on your heels, please. Okay, don't grab anything. Try to just stay on there as long as you can.
I
How much
can't.
tension your heels, or your...
My left heel is really
On
sore.
a scale of 1 to 10, what is that?
4.
3 push. Squat. Tell us about your knee.
It's just tight.
It's tight. On a scale of 1 to 10, what is that?
3.
X-rays are really pretty straightforward. You know, post-surgical stuff. You can see all the arthritis. Tons and tons of arthritis right above all those cervical fusions. And we're going to adjust probably... I don't know which one I want to adjust. I'm thinking about it right now. I've never done this before. I'm just kidding. I personally think I'm going to adjust right through the cervical fusions. It seems like the last thing to do, but again, think about cervical fusions as bringing all the bones together. They're hooked together through a plate. They're going to move as one single bone. The problem is that one single bone, it is one less. It's actually 2 less mobile bones in her neck. So it acts as one, so it's not quite as stable as it would be. But I think we're going to go right through that because I want to do the C4. Now I'm going to do C5. Good.
We have a 4mm right imbalance, 12-degree scoliosis, and a surgical plate. 17mm right short leg, pretty short. Constipation. 3/4 atlas wear. That's a lot. Reverse neck curve. C5 to C7 surgical neck fusion here. Here we have significant arthritis above the cervical fusion. Here we have no low back arthritis and constipation confirmation.
Okay. Good. We're going to bring this way. We're going to take our time. And she's been adjusted before, right?
Yes,
Gotcha. Have you had your neck cracked before?
I think so. A while ago, not recently.
So we're not going to go as hard as we can, but maybe like 95%. Good, right there. How tender is that?
It's sore, but
Sore.
not
Gotcha.
killer.
Come this way a little bit.
Oh,
Good.
whoa, baby.
Was that anything like you've ever had before?
No, that was a shocker.
Yeah.
But I did it.
You did. No, I did. Stop taking credit for my shit.
I lived. How's that? I feel good about it.
Better than you thought it was going to be?
Yeah.
She was terrified, guys, because she
Oh,
saw
I
the
was
videos.
horrified.
She goes, all those videos, nobody looks like they're having any fun with it. It looks terrible, right? But how was it?
It was fine.
Not nearly as bad as you
No,
thought.
it was doable.
Gotcha. Coming right in here. Come this way. Come this way. Relax.
Whoa.
Good. And again, guys, that was right through the cervical fusion.
Whoa, that was whoa.
Right through the cervical fusion. And you heard a lot of cracks. You're like, how can a cervical fusion crack? What's cracking above and below that? Okay.
Whoa.
Crazy, right?
Crazy.
Good.
You always worry about patients who come in with vertigo problems, with balance problems, that they're going to be lightheaded after the adjustment. So we want to be careful, lift them up slowly, and then see how they're doing. Let's listen in.
I feel peaceful.
Peaceful. Interesting. That's a good word. Anything else? You don't have to-
Lightheaded.
Lightheaded. Okay, perfect. Lightheaded is good, and you see that in a lot of my videos. The reason you're lightheaded is because I just rebooted your computer.
Okay.
So it's kind of like
Yeah.
making your body back in balance
Yeah.
feels out of balance at first.
Yeah.
So your body's trying to find that
Okay.
balance. Now,
One of the most important things that we call is recalibration. That's sending that adjustment in the neck all the way through the body, and this is what we're doing now.
I feel like my posture's better.
interesting, okay? And so what did I treat on you only?
My neck.
That leg on the right was a 2, I think, or a 3?
Oh yeah, it's less. Way
Gotcha.
less time.
Stand. Gotcha.
Wow, that was a shocker. I know you're great. You're the greatest.
I'm glad you decided to say that, not me.
I was gonna help you so you didn't have to.
Exactly. Look at the floor. Okay, and I don't know if that's any different because there was no pain
No.
before.
This
That's
actually is
definitely
easier,
Yeah,
looser.
I can see that.
Definitely looser.
Okay, stand your toes.
Oh, still wobbly, but yeah, it's
A little
fine.
different, right?
Yeah,
Now back on your heels, please.
but it's better. Look, now look at me. Okay, heels. No, not better. Whoa.
Now how about the heel though? How about the
Still
heel?
sore.
Still sore too?
Yeah,
Okay, interesting.
it's
Okay.
not any better.
Check your knee.
Yeah, a little better. I'm
bit
seeing
different.
improvement.
A little bit improvement?
Yeah, but
Perfect.
not on my foot.
Not in front, not yet. Good. So say goodbye, Mary.
Bye.
I'm gonna push down your shoulders, and so
Oh,
you feel this already, right?
yeah,
Okay, and so how much pain?
a lot.
A
It
lot.
hurts.
Take your time. Drop your shoulders. Drop it. There you go. One more breath. I'm gonna let go. Don't move now. Just stay right there. You can breathe normally. Now you should feel an overwhelming sense of relaxation.
I do.
This is why we want to do 8 pans, because if you do it correctly, you will always feel this sense of relaxation.
Right.
Does that make sense?
Yeah.
You
Well,
can recreate this for yourself. If you
By
do what I
8
say.
pans.
By 8 pans. Just a C7, T1. So let your head fall to the right here. Just fall to the right. Keep your shoulders down, please. There we
Ooh.
go. Woo!
Whoa.
Right
That
under
is
her
fucking
surgery.
gnarly. I'm sorry, it's so gnarly to me. Wow, it feels weird.
Shoulders relaxed right here. Good. So we're going to come this way. Good. Let me have this. Now bring your head forward, please. Forward. Chin out, chin out, chin out. Now let me have your head more. Drop, drop, drop to the left. There we go. Woo-wee!
That was good. My sleep is dramatically better.
Gotcha. The person who didn't think she slept bad at all.
Exactly.
Yeah.
So I feel really rested. I go to sleep immediately and it's deep.
So she came in for foot pain. How much better percentage-wise is your foot so far this week?
50%.
She has a fusion, C5, C6, C7. How has that been for you? Because I've adjusted right through the fusion, around it, or in it, and above it.
It's not a problem. It's super scary, but I'm fine.
Everybody out there is like, I've had a surgical fusion in my neck, I can't get adjusted. What do you have to say?
you can.
You
with
can.
Dr. Thayer. I
Exactly.
wouldn't recommend anyone else.
Fair
in
enough,
the
fair
world.
enough. Because all you guys out there have been told incorrectly by surgeons out there and a whole bunch of terrible chiropractors that it's impossible. Even her chiropractor, don't ever go there. All I've done on you all week is what?
Done adjustments on my neck.
Have I touched your foot?
No.
Your leg, your back?
No,
Have I massaged
nothing,
you at all?
nothing.
Nothing, just your neck.
Just my neck.
What do you think of the class?
I love it. It's super hard work. You have to
Super
really
hard work, yeah.
focus and change your ways, which
So
is
I
hard.
hope you guys realize that when you come in, if you want to get super better, you have to do super work.
Yeah, gotta do it.
If you want to do less, I'm okay with that. I'll take your money. But if you want to get better,
You gotta work.
you got to work.
All on you.
Because remember I told you when you move back and forth, you hear this grinding in your
Oh
neck?
yeah, I haven't noticed any.
Yeah, good, perfect. The reason I'm asking that question because when you see the X-ray of her atlas, you can see how worn out it is. That takes a lifetime of being a true fuck up to do that.
Thank you.
You're welcome. And she knows I love her.
Yeah.
Yeah. Good. So we're gonna go right at C4, C5, right where all that arthritis is. You can see the back of the bone completely going backwards there. So we're gonna push it forward into the right orientation so that the brain can take, right there, can take some pressure off the brainstem. And how does that work? It's all biomechanics, guys.
Oh god. That wasn't so bad.
You didn't say fuck.
I know, it wasn't so bad.
It wasn't so bad, right?
It felt like it was gonna be gnarly and then it wasn't. Feels sore this way.
Every time I adjust somebody, it's kind of traumatic because I'm going through the joint, I'm creating inflammation to a certain extent.
Gotcha.
So the scar tissue, as you help me and I help you, I'm getting deeper through the joint actually. It may not hurt as much, but I'm still going deeper and deeper to try to create change in the thing. Even though it was sore, it's still fairly comfortable, right?
Yes, I mean, well,
It's compared to my
yeah.
neck.
Yes.
Yeah, exactly.